story about one of my friends, a good friend in my residency, who went through undergrad and she thought, maybe I want to be a doctor, maybe not, I'm not sure, maybe I'll go through social work or into public health. And so after undergrad, she went into the Peace Corps. She went to Guatemala and she was assigned to a group who was building schools and wells. But then in part of her free time, she was up at the clinic doing medical interpretation. She had studied Spanish, she was a Spanish major in undergrad, and found that through that experience she realized that what she really wanted to do was medicine, and probably family medicine or one of the primary care fields. So really studying a language can help open up your options for what you might be able to do and give you a great experience. I mean, basically she can get any job she wants because she's had the Peace Corps experience. People really prize that. They know that she will speak Spanish really well, and she spends most of all her interviews talking about what it was like to live in Guatemala. The final story I have to share is about one of my attendings, Dr. Cazares, who was born in Mexico and lived there until he was about 10 years old, and then came to the US and studied medicine here. But when he was an undergrad, he started to become very interested in Chinese culture and the Chinese language and began studying Mandarin. As he went through medical school, he got more interested in Chinese medicine, and then during his postdoc training, actually became a certified Chinese herbalist and acupuncturist. And now at our clinic, he speaks to patients in Spanish and in Chinese and teaches all of his patients about some of the traditional Chinese medicines, about Tai Chi as a good form of exercise, and does acupuncture on them. I think this is a good demonstration of how language and culture come together, and he was doing an entirely different kind of medicine that came straight out of that culture, as well as through the medicine, and how we can integrate all of them to provide the best care for our patients. Okay, so we've heard today a little bit about learning languages in the classroom, but of course you've probably heard that the best way to learn a language is immersion. I definitely agree with that. You learn language a lot faster, plus it's a really good cultural experience. I've been fortunate to have 2 really good immersion experiences in terms of medicine. The summer after my first year in medical school, I won a NIH grant to study, to do bench research in Brest, France, with the dean of the medical school, the dean at that time. The only reason that I got that position was because I spoke French, because they needed someone who would speak French, go over there and conduct bench research in French. So we worked on isolating ancient DNA from Iron Age Celtic teeth to look for cystic fibrosis mutations. This is some of the equipment that we used. My husband came over with me. He was studying for his PhD in plasma physics at the time, and during the 6 weeks he was there, he studied at this international immersion school and was able to complete French 101 and French 102 equivalents and complete his non-technical minor in French. So 6 weeks and a lot of fun while we were there. It's worth it. My other time was just this past summer, fall. I spent a month in Costa Rica. My point for doing this was to learn medical Spanish, but also to understand how healthcare was provided in a different area of the world, looking at the socialized healthcare system. This is the clinic that I worked at. This is one of the nicer clinics in the area. I was in a very rural area that was isolated from the capital, San Jose, where most of the medical care is provided. And the doctor who opened this clinic did it so that there would be multi-specialty care closer to patients, and they wouldn't have to drive 3 hours anymore to see these doctors. This is just a view of the clinic from the front and then from the balcony. This is inside the clinic, just to get an idea of what it looked like. It was actually a very well put together clinic, but the construction techniques aren't the same as they are in the US, so things just tend to look a little bit more run down even when they're newer. But he had very good medical equipment. And in fact, the medical training in Costa Rica is on par to the training that we have in the US, or even more extensive. And some of you have probably heard about this, but people go to Costa Rica for medical tourism because getting non-covered surgeries there is less expensive than it is here in the US. These are 2 hospitals that I worked at. The first 3 photos on the left side were at a small private, they call it a clinic, but it's really more of what we would consider a hospital. It had an operating room and a few rooms for patients to stay overnight. I assisted with 2 C-sections here. I just think it's interesting the patient had her own blanket there. And in the US, we tend to use paper and disposable gowns, shoe covers, and the rest where they would use reusable. These photos are from the public hospital. This is their NICU, which is state of the art for them, and again had very good care, but limited access to things that we tend to take for granted here in the US. Got to see a lot about the culture and understand a little more about what makes the country unique. Saw a lot of fun animals and had a lot of fun. When you talk about learning language, and then we're talking about learning it for medicine, I just want to let you know you don't really have to know very much to get through a medical history and a medical exam. If you know the organs, and this is an organ chart in Spanish, you really don't need to know all these different organs and all these different pieces of anatomy, just the main ones, heart, lung, liver, kidneys. And then these individual words, you'll be able to do a medical interview. If you're going to go into OB, then you want to be able to say delivery, C-section, pregnant, and that's really about it. Because you can get through the rest with just these words. The other point I'd like to make is about contextual memory. I actually have studied a lot more French than Spanish, and I speak French better than I speak Spanish. But when I walk into an exam room, I have a really hard time making myself speak French and not Spanish. Because to me, the language that's not English that I speak when I'm in an exam room is Spanish. And so I recommend if you're studying a language and you're thinking that you're going to use it for medicine, to start thinking in terms of a medical process. Start going through, okay, what would it be like if I were to interview a patient about what's going on with them? And imagine yourself in a clinic. You do it all the time in language classes. You pretend that you're at the cafe or you're asking for directions in the museum. This is the same type of thing, but now you're in a hospital. This is the real medical language that you need to know. And this is what you're going to learn in your 101 and 102 classes. You have to be able to greet the patient. You want to say more, less, bad, good, better, worse. Ask them what types of foods they eat. What do they do for their work? What do you have to do? Do you lift things? Do you sit? What time is it? How many days have you had that problem? You're going to have to pay for your prescription. I believe you have this. I can give you medicine for that. You need to exercise more. And then be able to go through conjugations, past, present, and futures pretty easily because you can say you're going to do something, so you don't have to worry too much about that. I imagine most of you have iPhones or something similar now. These are some apps that I found especially useful. Really, there are many good books out there, but why show up at a place with 4 or 5 different books when you can show up with one iPhone and look at the apps? Some of these are only available in Spanish and some are available in other languages, but I definitely recommend having something that shows all the different conjugations of the verbs, something that can translate words for you. iTranslate is a really good one. The iStart Spanish, it also comes in Japanese, goes through grammar lessons that can be used to support other things that you were doing. I like both Spanish Dictionary and Conjugation Nation because they have games. It makes it a little bit more fun just to practice your learning. And then the last app actually gives you questions that are phrased as yes or no. So if you can learn how to pronounce the sentences, and it has them in English and in Spanish, then you can just check off it's a yes or no. One of the worst things is to go in there and say, what's going on, and have someone go off at you for 4 or 5 sentences and you have no idea what's going on. Other resources that I've used and found especially helpful, see I do like books. Google Translate's good. The Shom's outlines for grammar are especially good, and I did self-study with those before I went to Costa Rica. The 501 verb books, if you have it on your iPhone, you probably don't need the paper version, but it's a little bit bigger and easier to see, so you can go through and check your conjugations. Any type of pocket medical dictionary is good. There are medical language textbooks that Medical Spanish made incredibly easy. Medical Spanish for the health professional, there are just a whole bunch of them. You can buy them used. I like the ones that come with a CD. I put it on my iPhone and I listened to it as I drove to the clinic morning and back because I had a little bit of a drive. And it's one of those things where they will say a sentence, you repeat after them, and you can start learning how to put the longer phrases together. I also recommend just having fun with learning. I have the first 3 Harry Potter books in Spanish. I also have them in French. Read something that's easy, that's fun for you, and you already know the story. It makes it a little bit easier to get through. You have to be careful with things like Harry Potter, though, because they have a whole bunch of crazy and made-up words, and it makes it more complicated in another language. So this is a picture from Costa Rica, so another reason to go there. That's my husband, and he's looking off into the distance. So I just wanted to say something about looking forward. I get about 10 or more emails a day of jobs advertising for family physicians to come work. And many of them say bilingual preferred. Some will say Spanish because that's the most common, and some it's just any other language. And I found that as I apply, people are impressed with me speaking a language, even if it's French and something that, or a language that you're hardly ever going to use, because it shows that you've gone outside that typical realm of just the pre-med classes. You've taken a risk, studied something else, and you've shown that you have the intellectual ability to stretch yourself to learn something new, and that you can memorize really well, and that's important in medical school. So that's really all that I wanted to share with you.